Hi, I'm here today with Bill Hartman. He specializes in individual health insurance.
Yes.
And today we're going to talk about Medicare and the products that go into Medicare.
Okay.
So, Bill, who we qualify for Medicare?
Well, Medicare has been around since 1965, and Medicare is for anybody over the age of 65 or people with certain disabilities. Once they've been on disability for 24 months, they can qualify for Medicare.
Great. So, what is Medicare?
Medicare is a federal health insurance program that all of us pay for through our payroll taxes and that. So, Medicare is a federally funded by taxpayers to help pay for certain hospital and doctor type expenses.
So, at what age can people sign up? When can people sign up for Medicare?
Well, if somebody's approaching retirement or they're thinking about retiring, and let's say they're going to be turning 65, they should go to the Social Security office, or they can do it online at ssa.gov. They can go online, they can sign up for Medicare Part A and Part B. If they're already drawing Social Security, they will automatically get enrolled in Medicare A and B, and they literally have to sign off if they decided they didn't want it.
So, what are the products that go with Medicare?
Well, there's a number of different products. First of all, when we talk about Medicare, the thing you need to keep in mind is there's 4 parts. You've got Medicare Part A, B, C, and D. You also have what's known as Medicare supplements. Now, up until 2006, the only option people had was Medicare supplements. It wasn't until 2006 that Part D, or prescription drug coverage, even became available for most people. When they did this, they also created a second option, which is known as Medicare Part C, or Medicare Advantage. This has caused a lot of confusion for people because there's actually 2 ways you receive your Medicare. One, you let the federal government pay for the expenses, and whatever they don't cover, a supplement will come in and cover most, if not all, of those expenses. With a Medicare Advantage plan, it can be less expensive up front, but if you end up in the hospital, you have surgeries, you could pay more out of your pocket.
So, Bill, what if the people have coverage from work or from their spouse's employer?
If somebody's approaching retirement age or 65, they're thinking about Medicare and that, first thing they need to do is make sure that they contact the HR department with the employer, because some companies do require that you take Medicare. Others will allow you to stay on the plan as long as you're working. And a lot of times we'll sit down with people, we'll review their coverage, their options, and we'll simply tell them you really should stay where you're at, because the plan you have through the employer may provide a lot better coverage than what you can get on Medicare, and it may be more cost effective for you.
And then finally, if somebody want to meet with you for a consultation, how can they best contact you?
Best way is to call the office at 260-483-2305, or you can always visit our website, hartmaninsuranceservices.com. But we sit down with people. We'd love to do an evaluation with anybody that has questions, and we'll always tell you right up front what's going to be the best way for you to go. If it's to stay on group, we'll tell you that right up front.
All right. Thank you very much, Bill.
Thanks, son. Have a great day.